Atrial fibrillation is a condition of the heart where the small chambers of the heart, called the atria, instead of beating regularly, beat in a haphazard, irregular fashion. Now, this is a very common condition. Early on, it happens on and off. We call this paroxysmal atrial fibrillation, where one moment you might be in atrial fibrillation and the next moment you might be back in the regular atrial contraction. In this condition, patients really do feel symptoms because they go from being really well when their atria are contracting properly to suddenly feeling some sensations when the atria contract like this. And these sensations are called palpitations, the sensation that your heart beats. And it can make you feel very breathless. It can sometimes create chest pain and dizziness. It's a very important condition because it has serious consequences. Paroxysmal AF, if not treated effectively over the course of time, becomes permanent. Permanent atrial fibrillation is when the atria contract like this all of the time. And this is something that over a period, patients may not then feel so much because they get used to being in this illness state of constant atrial fibrillation. But that doesn't make it safe. Atrial fibrillation, whether it's paroxysmal or whether it's permanent, creates the risk of heart failure, a situation where the heart doesn't work properly and patients can get very breathless. They can develop high lung blood pressures, they can develop heart valve problems, they can develop swelling of their ankles, and this needs treating with medications. But one of the most serious complications of either paroxysmal atrial fibrillation or permanent atrial fibrillation is stroke. And the reason why patients with this condition are at higher risk of stroke is because this creates a high risk of clot formation inside the chambers of the heart. And these small fragments of clot can fly off into the circulation and land in the brain and create stroke. Patients with atrial fibrillation, if they meet certain other criteria, should always be started on a blood thinner to try and prevent this condition. Now, the worrying thing about atrial fibrillation is not just that it's very common, it often is silent. And if you get the sensation that you're feeling palpitations, or if you feel that your heartbeat is irregular, you must go and see your doctor so that he can look to see whether you have this condition and treat it effectively. Medical treatment is very effective for atrial fibrillation unless it is causing problems despite medicines. If despite medicines, the atrial fibrillation is still creating many symptoms, then some forms of treatment can be offered, either in the form of what we call atrial fibrillation ablation through a wire in the groin, or if you have an underlying heart valve problem like a leaky mitral valve, keyhole heart surgery, the most effective way to treat the condition then. The most important thing for patients is to always perhaps get used to feeling their heart rate, feeling their pulse, and it should always be regular. And if it ever feels irregular, a simple journey to your doctor could be something that's the difference between receiving important treatment or developing a very serious complication from an undiagnosed atrial fibrillation.